High blood sugar can wreak havoc on your health and in some cases be lethal, and it's the primary characteristic of type 2 diabetes. Dr. Milady Murphy is here to tell us how you can defeat type 2 diabetes. Dr. Murphy, thank you very much for being with us today.
My pleasure, Danny. You know, according to the New England Journal of Medicine, recent studies have shown that it is the most preventable disease, and we can reduce the risk in many cases by 58% by following some of their guidelines. What they recommended as a very powerful tool in reversing the effects of diabetes was exercise. Exercise 5 days a week was the formula for 30 minutes. Very powerful in helping to regulate blood sugar against this disease. You know, for people not used to exercising, 5 minutes a day for 3 weeks is a way to build on that because we're in it for a lifetime. 5 minutes a day, 3 weeks, and then add 5 minutes every 3 weeks till you get your goal. You don't have to do it all at once to regulate your blood sugar. You could do it 10 minutes at a time. Also, dietary changes in a weight loss process. You know, most of the time, diabetes is at a greater risk if one is overweight. So if you can eat healthier calories and regulate your blood sugar through healthy eating is another great way to prevent this disease and even reverse the process. If you don't know how to eat to regulate blood sugar, your physician can set you up with a registered dietitian. But this is what this study indicated, that these two powerful tools, exercise with that formula and proper nutrition to reverse the disease process, and you get a handle on it. And then if need be, your physician can put you on medication also to help in that formula of reversing the effects of this disease.
So definitely not all hope is lost if you go to the doctor and you say, I'm not sure what the symptoms would be, but they check you out and they say, hey, you've got type 2 diabetes. It's as simple as eating right and being more active.
That's right. And you know, dietary changes, and we can share a few with the viewers out there.
Absolutely.
High fructose corn syrup is a big culprit in abdominal cellularity, which is a contributor to type 2 diabetes. So if you drink lots of sodas and you've got diabetes in the family, work to cut it back and to 1 drink a day till you're able to eliminate soda. Drink water as a nice substitute. We're looking at trans fats as another contributor. Anything that says hydrogenated in the label reading, you may want to find the alternative in making that change. Instead of fried foods, consume baked, broiled, or grilled foods. Those are all powerful changes, not necessarily going on a diet, but making healthy choices that you empower yourself and you're taking control in this disease process.
It's not so much about eating less, it's how you cook in the foods that you choose to eat.
That's right, Danny. Absolutely, and making wiser choices. And these are very powerful tools. Also, be aware of some of the symptoms. You know, if there's diabetes in the family and you find that, you know, you're thirsty all the time, that may be a symptom. If your blood pressure is elevated, that may also be a symptom. Having a little girth here in the abdominal area, believe it or not, is a contributing symptom. So being aware of one's body, taking control of your health is all powerful tools along with the guidelines recommended by the American Heart Association, by the American Diabetic Association, to be aware of these things and to learn to incorporate these tools in reversing the disease process.
All right. Well, Dr. Murphy, thank you very much.
My pleasure, Danny.
It's amazing to me what you eat and exercise. That always seems to do the trick. Well, the Health and Wellness Center is located at Shelton State Community College. You can find out more about them online at sheltonstate.edu.